handouts or review materials must be treated with utmost confidentiality. It shall be the responsibility of the person whose name appears therein that the handouts or review materials are not photocopied or in any way reproduced, shared, or lent to any person or disposed in any manner. Any handouts or review materials found in the possession of another person whose name does not appear therein shall be prima facie evidence of violation of RA 8293. Top-notch review materials are updated every 6 months based on the current trends and feedback. Please buy all recommended review books and other materials.
Hello, kamusta ka na? I hope you're doing fine and well. I am Dr. Rubio, and for this session, we are going to discuss the part 1 of the hepatobiliary system, integration of anatomy, physiology, and your biochemistry. We're going to talk about today the liver, the gallbladder, and the biliary ducts. So for the first part of our session, we'll first talk about anatomy. Okay, remember guys, form follows function. So the liver is actually the largest internal organ in the body. Pag ang pag-uusapan natin guys is in general, the largest organ in the body, it would be the skin, definitely. Kasi pinapalibutan ng skin ang buong katawan natin. Pero pag ang usapan na internal organ, it is definitely the liver. It is also the largest internal gland of the body. Yes, the organ liver is a gland. It is both an endocrine and exocrine gland. Pag sinabing endocrine gland, di ba? These are organs that directly secrete substances into the blood. In the case of the liver, it directly secretes your albumin, your clotting factors, etc. While exocrine glands are organs that directly secretes their substances into ducts, going to different parts of the body. That is why the liver acts as an exocrine gland. It directly secretes bile and bilirubin into its bile ducts, papunta sa ating gallbladder, and also directly to the second part of the duodenum. Now, the liver is actually located at the right upper quadrant of the abdomen. And in patients with hepatitis, okay, in hepatitis, guys, ano ba nangyari dito? In hepatitis, there is the inflammation of the liver. When there's inflammation, lumalaki ang ating organ involved kasi nagkakaroon ng edema in the process. And kapag nagka-hepatitis ka, nagkakaroon ka ng pain. You can have right upper quadrant pain. So what is the rationale for the pain seen in patients with hepatitis? It is actually caused by the distension of the Gleason capsule because this liver here is actually enveloped by the Gleason capsule. It's a very tight, fibrous sheet covering the liver parenchyma. Now, the liver is actually supplied by 2 major blood vessels. You have here your hepatic portal vein and your hepatic arteries, right and left arteries. Now, in general, the liver is mainly supplied by the hepatic portal vein by 75 to 80%, while hepatic arteries only contribute to around 20 to 25%. Now, Doc, paano ba nagkakaroon ng isang hepatic portal vein? Actually, the hepatic portal vein is actually the combination of the splenic vein and the superior mesenteric vein. It actually occurs at the level of the neck of the pancreas. Diyan nagkakaroon ng combination ng dalawang veins na yan, forming your hepatic portal vein. This hepatic portal vein is actually rich in nutrients coming from the digestive tract. Kaya very good yung location ng ating liver kasi sinasalo niya yung blood na nanggagaling sa ating digestive tract para masala niya to for toxins at the same time para magamit niya yung mga nutrients dito for its further whole body metabolism. How about hepatic arteries? What is the origin of these structures? So for your hepatic arteries, it actually stems from your celiac trunk. Celiac trunk is actually one of the largest trunks of the abdominal aorta. At this level, your celiac trunk will give off to your common hepatic artery. Okay, this common hepatic artery will stay in this terminology until dumating ka sa level ng origin of the gastroduodenal artery. kapag lumabas na ang ating gastroduodenal artery from the common hepatic artery, this whole large artery, its terminology will change into your hepatic artery proper. Magbabago na siya kapag lumabas na ang ating gastroduodenal artery. And this artery will be subdivided further into your right and left hepatic arteries to supply the liver. Now for venous drainage, ang mangyayari dyan, you have your right, left, and middle hepatic veins. And these veins will eventually join the inferior vena cava. Kasama siya sa IVC, and the IVC will now direct the blood going back to the right atrium for its circulation. Now, let's talk about naman the ligaments of the liver. The liver is actually held in place at the right upper quadrant by several ligaments. As follows, we have your round ligament, falciform ligament, ligamentum venosum, and your triangular ligaments. As you can see here, the most prominent here in the image is your falciform ligament. This falciform ligament actually attaches the liver to the anterior abdominal wall, specifically the posterior surface of your anterior abdominal wall. And this falciform ligament is actually the remnant of your ventral mesentery, which is actually prominent in the fetal anatomy. Now, beneath this, we have your round ligament. The round ligament is actually the remnant of your umbilical vein. All right? You also have your ligamentum venosum. This ligamentum venosum is actually the remnant of the fetal ductus venosus, a very important structure for your fetal circulation. And of course, we have your right and left triangular ligaments. These are found at the upper aspect or superior aspect of the liver and is noted to attach the liver to the underside of the diaphragm. So kahit matanggal ang ating anterior na falciform ligament, the liver will still stay beneath the diaphragm normally. Kasi we have here your very strong triangular ligaments. Now the liver has actually a very unique surface. So you can see it's a pear-shaped structure. Now let's first orient ourselves para magets natin yung anatomy niya at the posterior inferior view. So at this part, this is the right side. Orient ourselves that is the right side of the liver, while this is the left side of the liver. Now, this will be your anterior aspect. This is the anterior aspect, while this will be your posterior aspect. Kasi dito guys, na nangyari, we are viewing the liver here sa kanyang posterior inferior aspect. So yun yung view ng ating liver in this image. Okay? Now, after orienting ourselves, let's now look into the different fissures and surfaces of the liver. So here we have your right sagittal fissure, while here naman we have your left sagittal fissure. These fissures are actually joined by a transverse fissure forming a letter H in the process. Now, as you can see here, guys, these fissures are actually dominated by different structures, which includes vessels as well as the gallbladder. Now, look first at the right sagittal fissure. Okay, sorry for the term fissure. So we have here the anterior limb. Since this is the anterior aspect or view, so this will be your anterior limb. And it contains the fossa for the gallbladder. Fossa means there's a depression, allowing the gallbladder to be situated at this place of the liver. Now, since this is the posterior part of our view here, this will be the posterior limb of the H, right? Of the right sagittal fissure. And this will serve as the groove for the inferior vena cava. Now, let's go to the left sagittal fissure. This is the left sagittal fissure. Okay, now locate yourselves into the anterior limb of this fissure. We now have here your round ligament. And this round ligament serves as the remnant for your umbilical vein. And lastly, focus yourself on the posterior limb. We have here your ligamentum venosum, which is previously the ductus venosus of the fetal anatomy. Now, still acknowledge this postero-inferior view. Now, let's talk about the one found at the middle. The one that combines your right sagittal and left sagittal fissures. It is your transverse fissure, more appropriately termed as your porta hepatis, because it is the one that serves as the port for the entrance for your portal triad, which contains your portal vein, the major arterials or the major blood supply rather of your liver, the hepatic artery, and your hepatic bile passages, which contains your different ducts. So this is the site of entrance of your arteries and the site of exit for your veins and your bile ducts. Now, we have now oriented ourselves with the surface and fissures of the liver. We will now talk about the anatomic lobes of the liver. Now, grossly speaking, pag nakita mo yung liver mo, it actually has two anatomic lobes. Okay, these anatomic lobes are actually regarded by the division of your falciform ligament. The falciform ligament is found at the anterior aspect of your liver, right? So this is the anterior view of your liver. If ito ang ating falciform ligament, therefore, this will be your left lobe, or this will be your right lobe. So anatomically speaking, mas malaki yung ating right lobe than your left lobe. Alright? Now, as you can see here, this is the location of your falciform ligament. It is at the level of your left sagittal fissure, which divides your liver into your right lobe and your left lobe. Now, still at the postero-inferior view of the liver, we still have two accessory lobes. And these are your caudate lobe and your quadrate lobe. Now, your quadrate lobe here, quadrate lobe, is actually located at the anterior aspect of your liver. Anterior aspect of the liver. It is your quadrate lobe. Now, caudate lobe naman, on the other hand, is found at the posterior aspect of the liver. Now, so for some quick mnemonic here siguro, para matandaan nyo siya. Caudate, cauda actually means tail. Alright? And sa makikita ang tails ng mga animals, diba? It's found at the posterior aspect of their body. So, the caudate lobe is found at the posterior aspect of your liver. Now, the liver is also divided into its functional lobes. Now, the basis of the functional lobes of the liver is its arterial distribution. Now, the right and left functional lobes are divided by the Cantley line. This Cantley line is found actually at the level of the gallbladder and the IVC. Okay, ito yung ating previously mentioned na right sagittal fissure. Now, this is actually very important because this allows the division of your liver into smaller segments. We have here your Cunard classification of segmentation of the liver. Now, this actually divides the liver into 8 segments, numbering them from 1 to 8 in a clockwise manner, beginning at the caudate lobe as your segment 1. So if this is your segment 1, this will be your caudate lobe. Tapos magbibilang ka niyan ng clockwise direction. So yun yung starting point mo. Then kapag nilit mo ang ating liver into your anterior view, as you can see here, we can now count it clockwise. So we have here your 2, your segment 3. Now this will be your segment 4. But your 4 is actually divided into your 4A and your 4B. Tapos, tuloy tayo sa ating clockwise direction. 5, 6, then magsa-7 ka na. 7 pataas, then 8 balik sa anterior aspect ng ating liver. That is how you count the liver segmentation by colon. Now, for some pearls, guys, the caudate lobe is always your segment number 1. It's a very testable concept. And the quadrate lobe naman, the other accessory lobe, is your segment 4. My mnemonic here, quadrate. Quad means 4. Segment 4. Okay, caudate lobe, you only have one tail per animal in general. So, your caudate lobe, which is the tail, one tail, okay, it's a segment 1. And having your canty line can divide the liver functionally into your right and left lobes. The right lobe actually contains only your 5, 6, 7, and 8. While your left lobe only contains your 2, 3, 4A, and 4B. Therefore, guys, take note that the segment 1 is not included in the right and right and left lobe functional classification of the liver. Take note of that, okay? Now, let's head to the biliary system and the gallbladder. So basically, after the bile canaliculi collects bile from the hepatocytes of the liver, they will form your different hepatic ducts. Of course, you will have your right hepatic duct and your left hepatic duct. These ducts will actually form your common hepatic duct. Now, this common hepatic duct will be actually joined by your cystic duct. This cystic duct connects the gallbladder into the common hepatic duct. And they will form your common bile duct eventually. Along the way, the common bile duct will be joined by the major pancreatic duct of Wirsung. And these two will eventually form your hepatopancreatic ampulla of Vater, which will be drained into the major duodenal papilla at the second level of the duodenum, rather the second part of the duodenum. Now, it's important to distinguish your major pancreatic duct of Wirsung because we also have your minor pancreatic duct of Santorini. And this will open into the duodenum independently via a minor duodenal papilla. Now, what sphincter is important in regulating the closing and opening of the ampulla of Vater? That is your sphincter of Oddi. It's a very testable question. And take note, guys, that the drainage of bile via the ampulla of Vater will occur at the level of the second part of your duodenum. Now, let's go at the level of histology. Very brief lang to, but let's discuss the liver tissue architecture. Now, functionally, the liver can actually exist into your liver sinusoids and your hexagonal structures. Now, anatomically speaking, your hexagonal structures will have a central vein found at the center. This central vein will eventually drain into your hepatic veins, will connect to your IVC. And as you can see, at the corners of your hexagonal structure, we have your portal triads. Since this is a hexagon, we have 6 corners. Therefore, we have 6 hepatic portal triads. These portal triads actually consist of your portal venule, hepatic arteriole, and bile ductules. Later, we will talk about the sinusoidal structure of your liver architecture in physiology. Now, let's talk about the special cells of the liver. Now, first we have your ito cells, or stellate cells, and they are mainly found at the perisinusoidal space of these. If this would be your hepatocyte, and this is your sinusoid. Sinusoid serves as the capillaries of your liver parenchyma. They are heavily fenestrated in structure. If these are your sinusoids and these are your hepatocyte, the space between them are your spaces of these. And doon makikita ang ating mga stellate cells, which serve as the major site of vitamin A storage. And kapag lamang na ang ating damage to the liver at di siya makomprehend o mabalansin ng ating liver regeneration, mag-a-act upon ang ating ito cells and stimulate your liver fibrosis. Kupffer cells naman and your pit cells are very important in physical detoxification. Kupffer cells are the macrophages of the liver and they're found at the liver sinusoids. Siyempre, kailangan na magsi sa ating capillaries kasi doon nila abangan yung mga blood-borne pathogens coming from the GI tract. And the pit cells can also serve as your NK cells. NK cells are part of the innate immune system, and these lymphocytes target your cancer cells as well as different viral infected cells. Lastly, we have your oval cells. If kanina you have fibrosis, the oval cells found at the canals of Henle are very important in liver regeneration. Guys, take note that the liver is the organ in the body that can perform its maximal regeneration without having fibrosis. Kaya pwede kang magkaroon ng liver transplantation easily because of this function of the liver. Now we head to physiology. Now, in general, the liver has 3 key functions. Actually, 4 in total. It has contributions to 1, to whole body metabolism. It is involved in many biochemical pathways, both anabolic and catabolic processes, the processing of the nutrients absorbed by the GI tract, and of course, in the secretion of your bile acids, which are very important for lipid digestion and absorption. It is, of course, involved in detoxification. Guys, pinag-isipan talaga ni God ang location ng liver natin. Sinadya ni God na 80% of its blood supply comes from the portal vein. The portal vein, as mentioned earlier, is the vein that collects most of the GI tract arterial, most of the GI tract blood drainage eventually. So, sinadya siya nandyan siya para matanggal niya ang mga toxins and poisons na pwede nating ma-ingest sa katawan before they are distributed by the heart via the systemic circulation. Next, like the kidneys, it is involved in the excretion of your waste products. But what kind of waste products? Mainly your lipid-soluble and protein-bound substances. Now, bakit? Only water-soluble products can be passed into the urine, which is basically water. And protein-bound substances can't be filtered through the glomerular interstices because these are too large to go through the fenestrations of the glomeruli. Recall that protein can only pass through the glomerular basement membrane in cases of nephrotic disease or damage to the mesangial cells of the glomerular structure. And finally, guys, the liver is important in the synthesis of bile acid in cholesterol, which is again needed for fat digestion. Let's first talk about the function of the liver in terms of whole body metabolism. First and foremost, liver plays a large role in glucose metabolism. The liver and the kidney in minimal contribution allows the conversion of your non-glucose constituents, such as your other sugars and amino acids, to form your glucose in the process known as your gluconeogenesis. Pangalan pa lang niya, gagawa ka ng new glucose in the process. Second, the liver acts as a glucose buffer. Binabalanse niya yung amount ng glucose sa ating katawan. If you are in the fed state, ang goal mo ay itago yung excess na glucose mo for future use. Therefore, glycogenesis will occur because you want to form glycogen from glucose. Remember that glycogen is the major storage form of glucose in the body. If gutom ka na at nalipasan ka na, you need to release the previously stored energy, the form of glycogen, via the process of glycogenolysis. Lysis, sinisira mo si glycogen mo para lumabas si glucose. Ganun siya nangyayari. And this will lead to the increase in glucose in the bloodstream during your fasting state. Now, for further integration with endocrinology, these major functions of the liver is mainly controlled by your insulin and your glucagon. Recall that insulin aims to decrease the blood to decrease glucose in the blood. Gusto niyang ipasok yung glucose inside the cells, insulin. So para mangyari yan, okay, kailangan mag-undergo ng glycogenesis to form glycogen and store them in the cells, mainly in the liver. Now, glucagon naman aims to increase the glucose in the blood. Glucagon. Lagay ng glucose ang ating blood. And para mangyari yan, kailangan mo ng glycogenolysis initially. But if hindi enough ang ating glycogenolysis, magre-rely ang ating liver sa gluconeogenesis to transform the other amino acids and other sugars into the form of glucose. Your liver is very important in fatty oxidation, fatty acid oxidation to be exact. They contain lots of enzymes that engage in fatty acid beta oxidation, and this can be used mainly for supplying energy to the body for its different functions. And more importantly, guys, it is the site of your lipoproteins, cholesterol, and phospholipid synthesis. Your lipoproteins are proteins that are important for transporting the water-insoluble lipids in the circulation. Kapag kumagbit ang ating mga cholesterol and triglycerides sa ating lipoproteins, they are now water-soluble. Hence, kaya mo siyang ma-deliver in the bloodstream. Now, it is also the site of your cholesterol and phospholipid synthesis. And these are important biomolecules for the formation of your cell membranes in the body. And the lipid metabolism function also of the liver also involves your estrogen destruction. Recall that estrogen is a steroid hormone. And doon siya mismong sinisira sa ating liver. It also serves as the site wherein we convert your cholesterol into bile acids. Bile acids are very important for your lipid digestion and absorption. And recall that the only site for excretion of cholesterol in the body is via your biliary excretion. Kaya guys, it is actually a potential treatment for your hypercholesterolemia to increase bile acid formation in the process. Liver has a huge role in protein metabolism. It synthesizes all non-essential amino acids. And it is the site of the formation of almost all of the plasma proteins, especially your albumin. The albumin is the major protein in the plasma of the blood. And it is the one that determines your plasma oncotic pressure. What do you mean by that? It means that hinahatak niya ang tubig from the interstitial spaces going into the blood circulation. It also has almost all of its clotting factors, the body, except for these major proteins. Immunoglobulins mainly come from your plasma cells, which are derived prior from your B cells, while factor VIII is the only protein-based clotting factor that is not synthesized by the liver because it is mainly synthesized by the endothelial cells. Now, for some clinical correlation. Now, liver cirrhosis means there's the fibrosis of the liver. Kasi, because of that, nasisira ang ating hepatocytes. If wala kang hepatocytes, you will have a poor synthetic function of the liver. Hindi ka makakagawa ng albumin in the process. If you have low amounts of albumin in the body, okay, yung fluid mo na dapat nasa loob ng yung blood, lalabas and will go into your potential spaces. In the case of liver, usually it will go to the peritoneal cavity and form your ascites. Since you have liver cirrhosis, you will have here poor coagulation factors. You are more prone to bleeding episodes. You will have the prolongation of your coagulation studies. And because you have liver destruction, estrogen is not destroyed in the body. So mainly in males to makikita, you will have your testicular atrophy. Liliit sila kasi you have high levels of estrogen in the blood. And you can have gynecomastia kasi estrogen can cause the stimulation of breast enlargement. And lastly, estrogen is a very strong vasodilator. It can cause the formation of your spider angiomatas, mainly in the head and neck area of the patient. Now, your liver serves as the critical site for the disposal of ammonia generated from protein catabolism. So ginagawa ng ating liver is that it converts your ammonia into urea. And eventually urea will then be transported to the kidneys for its excretion. In terms of detoxification, the most prominent function of the liver is your first pass metabolism. As mentioned earlier, strategic ang placement ng liver along the venous circulation of the GI tract. It receives majority of its blood supply from the portal vein. Thus, dumadaan ang mga bacterial toxins and drugs natin in the liver and will undergo metabolism and eventual inactivation. This is known as your first pass metabolism. This is the major reason why not all pharmaceutical agents in the bloodstream will achieve its optimal concentration levels. Kasi they are experiencing the first pass metabolism, especially when they are administered orally. Now, there are two levels at which the liver is able to remove and detoxify substances originating from the portal circulation. First is via physical detoxification, wherein blood from the portal circulation percolates among the Kupffer cells. Recall that Kupffer cells are found at the level of your liver sinusoids. And these are phagocytic cells important in removing particulate matter, such as bacteria, that may enter the blood even under normal conditions. The next level of defense by your biochemical metabolism. Okay, there are two phases actually involved in the biochemical detoxification of the hepatocytes. First, you have your phase 1 reactions, which involve your oxidation and hydroxylation. These may involve your P450 enzymes. Then after mo mag-undergo ng mga oxidation, hydroxylation, etc., to further detoxify the substances, we have your conjugation processes. Kung saan nag-a-add ka ng isang substance into the drugs or pharmaceutical agents to further make them inactive. So, depende kung ano yung kinakabit mo. It can be an amino acid, it can be glutathione, it can be your glucuronic acid, or even sulfate. Now, what will happen here? Now, some of the substances, kapag ang nabuo mo ay an inactive solute that is water insoluble, it will be mainly excreted in the bile and will be defecated afterwards. Pero kapag ang inactive solute mo ay isang water-based substance which loves water in general, it will be returned to the blood at pwede mo siyang maihi afterwards. That is the rationale why it is important to know the property of your drugs and its inactivated forms, especially kapag dumana siya sa ating liver. Now, let's talk about here the different liver sinusoidal zones, focusing on your sinusoidal structure. So, ang sinusoidal structure mo, ang two ends niya ay your hepatic central veins. As mentioned earlier, the central veins will eventually drain into your hepatic veins. Tapos sa gilid niya, mayroong dalawang portal triads. Therefore, we call that the hepatic veins. Veins na sila after coming from the liver. While your portal veins naman are actually rich in oxygen and nutrients. Yung kabilaang dulo ng ating sinusoidal structure are actually oxygen and nutrient depleted. Therefore, zone 1 is rich in oxygen nutrients, while zone 3 here are actually poor in these substances. So guys, because of this, zone 1 is more resistant to circulatory compromise. In cases of shock, walang ka ng blood supply to the liver, mas buhay ang ating zone 1 kasi nga mas well oxygenated ang ating zone 1. Katabi lang niya ang ating portal triad, remember? Therefore, necrosis will occur at the level of your zone 3. Siya yung merong first na site of damage. Furthermore, zone 3 is actually very sensitive to metabolic toxins. That is the rationale why at this area, you have high levels of your P450 enzymes to detoxify the invading substances. And some per lang, so we have also your intermediate zone, your zone 2. This zone 2, ang per dyan ay siya yung unang site na nadadamage mostly ng ating yellow fever disease. So yung 2 dito guys, it's your yellow fever. Alright? Now let's talk about your bile formation and secretion. So bile is definitely a fluid of the liver playing a role in lipid emulsification. Ano ba ibig sabihin ng ating lipid emulsification? Basically guys, ang goal ng ating bile is to destroy the bigger formation of lipid structures into smaller pieces of lipid para madali siyang ma-digest and absorb ng ating body afterwards. So this fluid is actually continuously produced by the hepatocytes. Okay? So for some first lang guys in definition of terms, recall that bile is made up of 10 bile acids, 3 phosphatidylcholine, and 1 cholesterol. That is the ratio of a bile fluid. Now, bile refers to the fluid, the mixture of these substances. Bile acids refer to the active component of bile derived from cholesterol. While bile salts naman is the formation of bile acids combining with your taurine or glycine, which are actually amino acids. Kasi mataas ang tendency ng bile acids natin to form combination with these amino acids. So again, bile is the fluid mixture. Bile acids is the active component, while bile salts naman is the combination of your bile acids and your taurine and glycine. Now guys, recall that tuloy-tuloy lang ang pag-synthesize natin ng bile coming from the hepatocytes. Okay, for a quick recap guys ha. So, ganun siya nangyayari. During fasting state, di ka kumakain. So, because of that, nakasarado lang yung ating sphincter of Oddi. Therefore, the bile will be stored afterwards to the gallbladder. Kasi nga, nakasarado ang ating sphincter of Oddi. There is a constriction of the sphincter of Oddi and the gallbladder relaxation. Now, during fed states, especially after fatty meal intake, bubukas ang ating sphincter of Oddi. Magre-relax siya, and the gallbladder will actually contract. Because of that, the bile that is continuously formed by the liver will of course go down to the duodenum. And the bile stored at the gallbladder will eventually go out and be released into the duodenum. Ganun nangyari ang ating bile flow. That is the importance of your gallbladder and a sphincter of Oddi. They regulate the flow of bile that is continuously produced by the hepatocytes. Now, what is the role of the gallbladder? Well, of course, it's for storage, definitely. Mainly kapag marami kang sinistore na bile at the fasting state. So if may magkakaroon ka ng bile concentration in the gallbladder, doon mo siya lalagay, it's actually good kasi it aims to concentrate bile in the process. So nangyari, the bile prior to gallbladder storage is actually high in sodium. Recall that sodium is always followed by water. Therefore, madadilute ng water ang sodium na mataas sa ating bile. Now, kapag ang ating bile ay na-store sa ating gallbladder, magkakaroon tayo dyan ng active na reabsorption of sodium in the process via these transporters. And because of that, magkakaroon ka ng low sodium in the bile, higher sodium will now be found at the capillaries surrounding the gallbladder. Because of that, water will then follow your sodium and water will be absorbed in the process, making your bile more concentrated. Which is actually good kasi aim mo nga na magkaroon ng lipid destruction. Mas lumito nga nilang micelle formation para mas madali mo silang madigest and absorb yung ating mga lipid substances. Now, gallbladder control is mainly influenced by hormones followed by vagal stimulation. The major hormone responsible for gallbladder contraction and the relaxation of the sphincter of Oddi is cholecystokinin. This kinin is actually produced by the eye cells, right? And they're mainly stimulated by intake of fatty meals. Second naman, we have your acetylcholine. This acetylcholine is actually imported mainly via the vagal stimulation. Vagal stimulation occurs at this point via cephalic phase of digestion. Yung moment na nakita mo yung pagkain mo pa lang, gutom na gutom ka na agad or maisip mo man siya, you will have vagal stimulation. And this vagal stimulation will cause the release of acetylcholine at the level of the gallbladder and will cause weak gallbladder contraction. Kasi gusto mo nang, pinipray mo na nakakain ka eh. Therefore, you must secrete some bile into the duodenum to prepare the body for the presence of food, for digestion. We also have your secretin, mainly coming from your cells. Now, ang goal mainly ng ating secretin in biliary function is to release your bicarbonates. Bicarbonates are important kasi gusto mo kasing neutralize yung acidity ng ating chyme fluid. Chyme fluid is the form of fluid coming from your stomach kasi it's very acidic. Kailangan mo kasi ng alkaline media para ma-activate yung ating mga different na pancreatic enzymes in the process. So recall guys that secretin is involved in biliary and pancreatic bicarbonate secretion. But what hormone is responsible for pancreatic enzyme secretion? It will be your CCK. So CCK po ang responsible for the release of your pancreatic enzymes in the process. Now, anong nangyari guys eventually is that magkakaroon tayo ng reabsorption of bile acids which occurs at the level of your terminal ileum via your sodium bile acid transporters. Now, bakit ka nagkakaroon ng ganyang form of phenomenon? It is mainly due to the balance of your bile acid synthesis and the amount lost in the stool. Kasi nangyari dito, constant lang kasi yung value na yan. Alright? So you have to reserve some bile in the process. Hence, you have your enterohepatic circulation of bile acids occurring at the terminal ileum level. Now we head to biochemistry. This is still related with the physio of your liver and bile ducts. Pero ito, more on the functioning side siya, okay, ng ating bilirubin and your bile aspect. So we head to bile acid synthesis. Cholesterol is a very important steroid in animal tissues. It's actually a 27 carbon compound with 4 fused hydrocarbon rings. In the body, it's mainly stored as your cholesterol ester. And kapag tumataas ang levels ng cholesterol mo in the body, you want to excrete them from the body. the only route of elimination of cholesterol is via your biliary excretion. That is why liver function is very important in cholesterol balance. Now, these bile acids, okay guys, are mainly produced by your hepatocytes. They serve as end products of your cholesterol metabolism. Okay? Cholesterol will become primary bile acids via your cholesterol 7 alpha hydroxylase. That is the rate-limiting step of this bile acid formation. Now guys, in studying biochemical pathways, you should know the reactants, the products, and the rate-limiting steps. You don't need to memorize the very step-by-step process of metabolism. You should know first and foremost the salient features. If may time ka, saka mo sila takiyin afterwards. That's my best tip in studying metabolic pathways. Now, the primary bile acids, as mentioned earlier, are the ones that are directly synthesized by your hepatocytes from cholesterol. So, nabubuo sila at the level of the liver pa lang. Now, there are two main primary bile acids. Your cholic acid and your chenodeoxycholic acid. Now, madali lang yan guys. Yung dalawang C dyan, yan yung ating primary bile acids. Automatic na yan. Alright? Now, eventually, these primary bile acids, when they enter the small intestine, they can be exposed to intestinal bacteria, which can destroy and convert them into your secondary bile acids. So they are merely the products of bacterial metabolism happening at the level of the small intestine. Nangyari dyan, cholic acid becomes your deoxycholic acid, where chenodeoxycholic acid becomes your either litocholic acid or ursodeoxycholic acid. But among the bile acids, guys, the most toxic is your litocholic acid. So this litocholic acid is actually not absorbed in your enterohepatic circulation. Instead, it is actually sulfated in the process para hindi na siya ma-absorb ng receptors at the terminal ileum. Now, lastly, we will discuss how we form and excrete your bilirubin. Now, bilirubin is actually a metabolite of heme. Galing siya sa ating heme substance. At kailangan mo siyang matanggal sa katawan because this bilirubin substance is actually potentially toxic to the body. Now, 80% of bilirubin comes from your red blood cells. Okay, it's found mainly in your hemoglobin kasi hemoglobin contains heme. The remaining 20% of bilirubin will now come from other heme-containing substances. One, we have your myoglobin, which contains one heme structure. And we have your cytochromes found mainly in the electron transfer chain, as well as different enzymes. One of them is your catalase. Now, the problem with bilirubin is that it can cross the blood-brain barrier. Kaya kailangan mo talaga siyang matanggal eventually. If it accumulates in the body, it will form jaundice, okay? Can actually cause icteric sclerosis. According to Harrison's, at least 3 milligrams per deciliter can cause ictericia or having icteric sclera in the process. However, if the levels of bilirubin are too high in the process, it can actually go, as mentioned, to the brain and cause kernicterus in the process. It is function of the brain being caused by high amounts of bilirubin. And a major site of storage ng bilirubin at the brain will be the level of your globus pallidus. So how do we form bilirubin naturally in the body? So it actually occurs mainly at the level of your phagocytic cells of the RES. Dahil ang ating mga phagocytic cells ang responsible for the destruction of your old red blood cells. So this process mainly occur in sites kung saan nasasala mabuti ang ating mga senescent or old RBCs. It can be at the level of the spleen or even the level of the liver itself. So your heme will be exposed to your heme oxygenase enzyme. It will liberate iron in the process. And it will transform heme into biliverdin. Biliverdin, from the name itself, means that it gives off a greenish color. Kaya siya biliverdin. Eventually, biliverdin will undergo production via your biliverdin reductase. And this will convert your biliverdin into your bilirubin. Okay. Now guys, kahit na rubin ang nasa name niya, it actually gives off a yellow color. Kaya ka meron pannilaw kapag meron kang jaundice. Now guys, recall that bilirubin is actually insoluble in water. It hates water. So paano mo ma-transport ang ating bilirubin from your liver and spleen para malagay mo siya sa proper site of disposal niya? Mainly sa liver nga, as mentioned nga earlier. So kapag ang site ng destruction or formation of bilirubin rather ay extra liver or extra hepatic, this bilirubin must combine with albumin in the process and form an albumin bilirubin complex to make bilirubin water soluble. Para kaya mo siyang ma-transport in the circulation, and eventually this complex will be taken up by the liver for further processing. Now, the albumin bilirubin complex of the bloodstream will be taken up by the space of this. As mentioned earlier, this space contains plasma and is found between the hepatocytes and the liver sinusoids. Now, mangyari dyan, we have your special transporters found at the level of your hepatocytes, at the basolateral aspect of your hepatocytes. These are your OATP transporters, which aims to transport the natural form of bilirubin, its unconjugated form, from the space of these coming inside the hepatocytes. Now, inside the hepatocytes, meron kang diyang enzyme that serves to detoxify the very toxic bilirubin. So, nagkakaroon ka dyan ng conjugation process para ma-limit mo ang toxic effects ng ating bilirubin. So, nag-a-add ka ng glucuronic acid and it will make your bilirubin conjugated bilirubin. And this time, it's now water-soluble. Kasi nga, nabigyan siya ng isang protein substance which is actually aqueous, which is actually soluble in aqueous media. Now, ano mangyari afterwards? You want to release this conjugated bilirubin and allow it to be excreted from the body. So para mangyari yan, you need your MRP2 transporters, and they allow the transportation of your conjugated bilirubin from the hepatocyte going to the biliary canaliculi, eventually going to the biliary system of the body. Okay? So ating OATP transporter transports unconjugated bilirubin from the space of these going to the hepatocytes, while your MRPT naman transports the newly conjugated bilirubin from the hepatocyte going to the canaliculi and eventually to the biliary system. Now, we aim to excrete this conjugated bilirubin. So naturally, this bilirubin will be transported into the intestines. And via the action of bacteria, it will now become your urobilinogen. Now, magkakaroon dyan ng point of kung saan magkakaroon ng different pathways. Depende sa mangyayari. Your urobilinogen, if it is non-oxidized, hindi siya na-oxidize in the process, it will maintain its form and will be reabsorbed into the bloodstream. Eventually, this urobilinogen will be transported to the kidneys and will undergo an oxidative process, becoming urobilin. This urobilin gives urine its yellow coloration. Now, if urobilinogen is oxidized, it will now become your stercobilinogen. Okay? Now, this stercobilinogen will further be oxidized and form your stercobilin, which will now be excreted with your feces. That is the rationale why your feces will have a yellowish coloration because of the presence of your stercobilin. That is how you excrete bilirubin in the body. And that is all muna guys for your OSI part 1 of the hepatobiliary system. I hope you learned some new things today and I hope na reinforce yung ating pinag-usapan for the past months in Genesis. Okay, now we will now apply this reinforced material for your OSI part 2. So guys, stick around and see you guys again for the part 2 of your hepatobiliary OSI discussion. See you guys and ingat palate. Bye!